Hey everyone, today we're going to talk about something that I am sure way too many of you are familiar with, that annoying, persistent dry cough that just won't quit. It messes with our sleep, it interrupts our day, and honestly, it just leaves you wondering what on earth is going on. So let's dive in and figure out what our bodies are really trying to tell us. Does this feel a little too real? That nagging cough that seems to have been around forever. Maybe it gets even worse the second you lie down at night. It's super frustrating, for sure, but it's also a really clear signal from your body that something needs your attention. So here's how we're gonna break this all down. First, we'll decode what a cough actually is. It's probably not what you think. Then, we'll explore all the different reasons you might have one. We'll look at some simple things you can do at home for relief. And then, this is important, we'll talk about the red flags. When is it time to see a doctor? And finally, we'll get into the right way to treat it. Okay, first things first, and this is absolutely crucial to understand. A cough is not the disease. It's not the illness itself. Think of it more like the check engine light in your car. It's a symptom, a warning sign that's pointing to some other issue under the hood. You know, it's kind of funny to think about, but a cough is actually your body's friend at first. It's one of your lungs' best defense mechanisms. It's this powerful automatic reflex designed to blast out anything that doesn't belong. Dust, germs, smoke, you name it. The real problem starts when that defense mechanism gets stuck in the on position and just doesn't stop. So, if a cough is just a symptom, the next obvious question is a symptom of what? Well, as you're about to see, the list of potential causes is surprisingly long, ranging from the super common to the pretty complex. All right, let's start with the usual suspects. Viral infections, right? The flu, a common cold, they can leave you with this annoying dry cough for weeks, even after all your other symptoms are long gone. Then you've got allergies, pollen, dust, pets, and environmental stuff like smoke or pollution. And don't forget post-nasal drip. That constant trickle down the back of your throat is a classic trigger. But sometimes, a dry cough is a clue to something bigger. It can be a telltale sign of asthma, or even GERD. You might know it as acid reflux. That's when stomach acid creeps up and irritates your throat. Even certain blood pressure medicines can cause it. And it can also point to more serious conditions like COPD, heart failure, or something called interstitial lung disease, which causes scarring in the lungs. And this really nails it. As one of our sources puts it so simply, there are countless reasons for a cough. This is exactly why a cough that just hangs around can't be ignored. It needs a proper investigation, not just a quick fix from the pharmacy. Now, while you're trying to figure out the root cause, you still need to live your life, right? You need some relief. So let's talk about a few simple, effective things you can do at home or right now to soothe that irritation. So, what do all of these have in common? It's all about moisture and calming things down. Staying hydrated with plenty of water is huge. Using a humidifier in your room or just taking some steam inhalations helps moisten the very air you're breathing. A spoonful of honey and warm tea is great because it literally coats your throat, and gargling with warm salt water can give you that instant relief. But, and this is a really important safety warning about the honey, while it's great for adults and older kids, you should never give it to a baby under 1 year old. There's a serious risk of something called botulism, so please keep that in mind. Okay, so home remedies are fantastic for making you feel better in the moment, but they don't fix the actual problem. And that brings us to maybe the most important part of this whole discussion, knowing when it's time to stop trying to handle it yourself and actually go see a doctor. If there is one number I want you to remember from all of this, it's this one: 3 weeks. Every source agrees on this. If your cough, dry or not, sticks around for more than 2 to 3 weeks, that's your signal. It's time to get it checked out. It's officially moved from annoying to needs a diagnosis. And listen, there are some symptoms that are absolute, non-negotiable, see a doctor immediately red flags. If you have that cough and you're short of breath, have chest pain, are losing weight for no reason, have a fever, or your voice is getting hoarse, you need to go. Coughing up blood is always an emergency, and honestly, if the cough is just so bad that you can't sleep or get through your day, that's reason enough. All right, that brings us to our final section. Let's talk about treatment and being cautious. Once you're with a doctor, what's the right path to actually getting rid of this thing for good? The whole goal is to treat the cause, not just the cough itself. It's like if your car is making a weird noise, you don't just turn up the radio, right? You find the source of the noise. A doctor will use your symptoms and maybe a test, like a chest x-ray, to figure out why you're coughing. Then,
And only then can you get a treatment that's actually going to work.
And this is where we see a huge difference in approach. The temptation, I get it, is to run to the pharmacy and just grab a bottle of cough syrup. But the right move, the smart move, is to talk to a doctor first. So, why is just grabbing a syrup such a bad idea?
Well, one of our sources puts it perfectly. Don't take cough syrup without knowing the cause. See, if you take something to suppress your cough, you might just be hiding the real problem. If you have an infection, a cough helps clear it out. If the cause is acid reflux or a heart condition, that syrup is doing absolutely nothing helpful and is just delaying you from getting the treatment you actually need. So, we'll end with this question. That persistent cough that's been driving you crazy, it isn't just an annoyance, it's a message. It's your body trying to tell you something really important. The only question left is, are you listening? Thanks for watching.